On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is Rodney Wambeam, a senior research scientist at the Wyoming Survey Analysis Center. Dr. Wambeam and his team conduct numerous substance abuse prevention and treatment research projects in several states. He has presented more than 50 keynotes across the country on substance abuse prevention with millennials and on the history of alcohol in America. His book, the Community Needs Assessment Workbook from Oxford University Press, came out in 2015. Hello, Rodney, and welcome to Prevention Perk.
Thanks. It's great to be here.
Yeah, it's good to have you in the seat. I'm always curious about my first question because it informs a lot about how we all end up in the work that we do. So what was your path to prevention? How did you specifically get involved with this?
That's interesting. I mean, I've known I've been doing prevention for 25 years now, prevention research. And I know the thing is the path for everybody is, I think, slightly different. Mine is maybe more unique because I've known I have a good friend who ran a prevention system in the state who got her degree in art education, but I don't think a lot of people come out of social work or other fields like that. My path was that for most of my life, I wanted to be a professor. And I was getting my Ph.D. at the University of Nebraska in political science, American government. My second area of focus was public administration and policy analysis and program evaluation. And I learned that I was one internship away from having a certification in program evaluation. And so I didn't know what to do. I talked to somebody and 3 hours later, I was an advisor to the governor of Nebraska. And I really enjoyed it. Like I liked working with the Department of Health and other people. And then I was out of funding and I just had one semester left to defend my dissertation. And I needed to have a job. I mean, graduate students don't get paid well anyway. I just needed to have a job. Literally looking through the Lincoln Journal-Star, which is the newspaper in Lincoln, Nebraska, and there was a job for a program evaluator. And literally the only time in the history of program evaluation, there was a job for an evaluator in the classified ads. And I responded to it, and it was a place called the Nebraska Council to Prevent Alcohol and Drug Abuse. And it was for a guy named Steve McElravy. He was the director there. He later went on to CSAP. I got this job. A couple months into the job, Steve said to me, you were the only one that applied, right? Like program evaluators are not looking in the classified ads. Here, I have this PhD and I'm about to defend. And so I just worked for this little group in Nebraska that kind of helped with the state system. And while working there, two things happened. One, we wrote the proposal with the state for something called the State Incentive Grant, that original SIG. And two is I just fell in love with working with communities. I just liked it so much more than teaching college freshmen or anything like that. And so here I was working for a nonprofit. And it was in prevention. I never even knew it was a field. But the field itself, it touched me. It's like prevention is in my blood, I think, the way I live and what I believe. And so it struck me, and I was out on the job market to be a professor, which had been my goal all along. I come from a family of educated people. My father-in-law was a political science professor and my mentor. And I went out on the job market the first year. I came in number 2 for a tenure track position at the University of Maine. And the next year I had my dissertation. And this was the year I was going to get my job. And the night that the newsletter came out with all the jobs, I was not making this up, 30 years old in the hospital with heart palpitations. And I thought, like, this is so stressful for me. And I didn't know what to do all week. And my wife, who has this like incredible way of cutting to the chase, on Friday morning, I'm upset about it. She says, "So I thought you loved your job." And I said, "I do. I love that job. But my dream was always to be an academic and a professor." And she says, "What is it you like about being a professor?" And I said, well, she says, is it like teaching those college freshmen? I said, no, I'm really burned out of the teaching and stuff. She says, "Is it like all the academic publishing and stuff?" And I said, God, no, I hate that. Like, that's the worst. And she says, is it going to the coffee shop with your tweed jacket and khaki pants? And I said, kind of, you know? And that was the moment I thought I could do this work, this research for real people in the real world. And it was great. And not long after, the state of Wyoming, which is where I grew up, um, they also got the state incentive grant. And I met them and they said, you should come do this. And they sucked me away to the department I work in here now at the University of Wyoming. And so I am an academic, but prevention, I'm a senior research scientist. I'm a research faculty. I don't teach, but I train and do the things we do in prevention. And I've been doing it for 25 years. And I love it. And so that's kind of how I got there. And it's a nice balance between sort of academia and research, but working with real people in the real world, which is what really makes me happy at work. So that's my journey.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Community engagement, an essential component for an effective and equitable substance use prevention system, is available as a free download. This guide highlights research on community engagement in substance use prevention and provides practical guidance for implementing and evaluating community engagement strategies and activities. You'll find a link to this resource in our show notes. Well, now you're a researcher, and as I was looking through some of your bio, you've done some research with a friend of the podcast. We've had Dr. Jeff Linkenbach from the Montana Institute on before, and you guys have done some work together. Can you talk a little bit about your work around the youth misperceptions of peer substance use norms?
Yeah, so Jeff is great. Love him. Friend of mine. Haven't seen him in person since before COVID, but we met when he was working on a project here in Wyoming. So I'm a faculty member at the University of Wyoming in Laramie, where winters are long, but it's an incredibly good school and a good place to work. And he was working on a project in Wyoming, and I was working. We became friends, and I'm really interested in especially around cultural issues and environmental issues and things like that. And so we had just connected in a lot of areas around that notion of culture and his work with misperceptions and social norming. And what we wanted to really understand is based on the frameworks that we were following and that sort of underlie everything we do, right? So I do a lot of talks about prevention science and stuff, and I tell people if you've only ever read 2 articles in the history of prevention, you should read 1992's article by Hawkins and Catalano and others around the risk and protective factors, everything that became communities that care, and what in Wyoming we call the prevention needs assessment. Other places, Pride Surveys does it, everybody does it. And the other article will be 2004, Joe Berkmeyer, Harold Holder, Karen Friend at Pyre, who did the broad causal areas, right? Well, those risk and protective factors that Hawkins and Catalano came up with are really good. And Michael Arthur had created all these cut points. And a colleague of mine here at the university has done since 2004, it's the 20th anniversary, that survey for the state of Wyoming. And we would traditionally look at risk factors and go to communities and say, you're high here, you're high there. But we knew we'd been doing a good amount of work around risk factors and what they were. And then, we're working with Jeff and a colleague of his, Jay Otto, who started in Wyoming. And we're looking and saying, this notion of misperception seems really important. And at its most basic sense, it's just like when kids think that everybody's using, then they use too. It's in really early in my career, back when I was in Nebraska at that Nebraska Council, I did focus groups with middle school kids. And we would say to the middle school kids in this focus group, how many kids in your school use cigarettes? And they would say, everybody's smoking. It's crazy. Everybody smokes. And we say, who are they? And they'd say, in this school of 800 kids, they say, those 10 kids under a tree. And somehow they saw that as everybody, right? And so this notion of misperception is so big, because if kids, they want to be normal, right? And so Jeff's thing and the notion of this idea of social norming is all about correcting perceptions. And so what we did on our youth survey was add a question about perception. We still have it on the survey to this day, but where we asked that question that we all use in prevention, in the past month, on how many occasions have you used alcohol? On how many occasions have you used cigarettes, vaped e-cigarettes, whatever. But we also had the question in the past month, on how many occasions have most of your classmates used, right? And to give you a sense of that, we asked that around methamphetamine in a small county in Wyoming, where this town, Newcastle, right? There's a few hundred kids in the whole county. But we asked it in the high school, and you get this sense of perception, right? So you ask, in the past month, how did most of your peers use methamphetamine, right? And so what did we find? Roughly 66% of the kids in that high school thought that on a monthly basis, most of their peers used methamphetamine, which to start with, would be one crazy high school, right?
Yeah.
But that was their perception. But, we also asked, in the past 30 days and in your life, have you ever used methamphetamine? And the number of kids that in that high school that had ever in their life used methamphetamine? 0. Not a single kid had ever even tried it, but their perception was that everybody was using it. And so, Jeff's point is, and the point of social norming is to close that gap. That if you can teach those kids in that school that nobody uses meth, and that if you did it, you would be the only one in the school, that peer pressure will work the other way. So what we did was we took that misperception and we measured it. And my colleague talked to Michael Arthur and others at the Social Development Research Group, and we turned that misperception into a risk factor, just like attitude toward drug use, perceived harm or risk, or any of those, right? And we created it as a risk factor so that we could take it and measure it against all the other risk factors, and then look at how well it predicted alcohol use, right? So does misperception predict alcohol use, as well as perceived risk and harm, as well as parental attitude, and what we found is it was a really good predictor. The misperception does a pretty good job of predicting whether or not kids will start using. We also found that it was a better predictor in younger kids, 6th and 8th graders, than like 12th graders. That was the gist of it. And the point of all of that, I think, is that there's a lot of literature. I'm sure Jeff talked about this, around social norms can work. And what it made me believe is that if you're going to, in a community, have a comprehensive approach to prevention, that social norming and misperception should be part of that approach.
Well, it's interesting because you said it's more common, the younger age group. So it makes sense that we start, our prevention efforts as early as we possibly can. It's inherent, possibly. I'm not an expert with a younger mindset, that things are more, I don't know, black and white, or, it's like, this is just everybody's doing it, and so I could see how that could take root. And then if, one thing leads to another, you're going to have a higher incidence of some risk factor in your community. So primarily we do look at, trying to prevent substance use amongst youth, but then across different generations. How's that? How does looking at, I'm a boomer, so how's looking at my generation, and then coming, through millennials and so forth, how does looking at, prevention across different generations impact the future of prevention? I mean,
well, so
Is
Yeah.
that just because we're evolving all the time, or how does there more science behind how that's an impact?
Um, so it's a really like the generation questions. First, let me start by apologizing that you're a boomer. I'm so sorry that you had to be part of that. I'm like a card carrying member of Generation X. And so we're mostly defined by how much we hate boomers. As growing up, I'm really
I
joking.
see, Rodney. I think we're separated by maybe 365
Yeah,
days.
I know. Well, you should know. But what it means to be a
I still
card,
have to carry that A on my
yeah,
breast.
right. So I no, I'm like to give you a sense of what it means to be a Gen X. Like for me, like my wife and I, we saw 16 candles on her 16th birthday. We went to Pretty in Pink the same week we went to prom, and I own the Breakfast Club poster, right? Like I'm full on
You are in.
Billy Idol, Cyndi Lauper. In fact, the phrase Gen X actually came up in the 1950s with photographers. That was where it was first used. But the reason it's attached to my generation is because it was the name of Billy Idol's first band in England. But in any case, so the thing about generational research is really curious is you have to put aside for a second that there is like the notion of a zeitgeist, right? That a generation, a group of people that come up together have a sort of a sense. And there are arguments to say there isn't, that the 365-degree days that separate you and I really don't make a difference, right? That cultures do move and stuff. But if you believe it, there are different times, there are different ways to think about it. And
Well,
I
when you talk about that, I think, and I'm this is an interesting subject for me as well, is I think that that's reflective in the music itself. Like every generation kind of has nobody's coming up with per se something new. It's
Mhm,
just a different way of looking at it, and different things are happening in the world around us. Like
right,
look at when rock and roll started, look at what the first half of the 60s and the last half of the 60s, like, and that music was in which informed it. The culture, did it inform it, or did the music
right.
inform it? So yeah, I think
Yeah,
there's a lot to from that perspective. But then we're talking
yeah.
about substance use here, and messaging across the generations has to be different. Drugs of popularity, those kinds of things.
No, it is absolutely. It's an interesting because it's not just music, it's all pop culture. It's our music, it's our advertising, it's our movies and our TV shows and how those are presented. And all of those tend to have something to say about alcohol or cigarette smoking or whatever. Um, and so we're touched by those, and they are. I once graded a paper by a young woman who I was teaching American Studies, and she had written a paper about Bart Simpson years ago, when the Simpsons are still on, and she just was the whole paper was about how horrible Bart Simpson was and what a terrible role model and all this stuff. And one of my comments to her was, "Are you sure that he's the one leading, or are they just making Bart Simpson look like the kids? Like, is he a reflection? And so you get both of those things. But I do think when you come up and when you're coming of age, those things matter. The music matters, the shows matter, and what you learn from your peers and stuff. So which gets to maybe more importantly, what we're facing today, right? Because the younger generations, and I did this big keynote on millennials all over the country, and it was a ball of fun. But the younger generations are different, right? And I'm disappointed that we call them Gen Z because that's just counting letters. Like every generation has gotten to sort of call themselves whatever they want. But the people today that are starting college, that are in high school, have had such a different really experience than we have. And there's a couple pieces of that. One of those things I think is critical is the internet, social media, and all that. Like I tell my children, I know it seems bad, like, but there was a Dust Bowl, there was a Great Depression, there was a Vietnam War. The difference was it wasn't just in your face all the time, right? And the other thing is, of course, they experienced COVID and a global pandemic. Now, for some people, that wasn't traumatic. Uh, if you look at, I have 10-year-old twins. If you look at like a third of their life was in this pandemic, and they just thought it was the best thing ever. Like everybody was at home all the time. We watched movies every night. That was not traumatic for them, but for many people it was. And we lost more than 1 million Americans. It was a terrifying time for a lot. And so that was difficult. And then you've got all this like barrage of stuff. A friend of mine said to me recently, every day 1 in a billion events happen, and we get to read about each one of them, right? And so it's just in your face all the time. And then on top of it, with this little handheld computer you have, it's just this constant access, constant comparing yourself, things like that. And it changes. There's a good book on, I can't remember the title of it, but it changes the way your brain works when you're looking at that. Like from reading books and things to this, like, I just need this 1 second headline all the time. I heard a guy on public radio once talking about, he said, if you had a friend who right before bed opened a bottle of wine and poured a glass and then drank it, in the middle of the night, they reached over to the bedstand, poured another glass, and then drank it. And in the morning, the first thing they did when they got up was pour a third glass and drink it again. You would say, you have a serious problem. But that's what so many people do with their phones every single night. And it's a problem. So I think, going from this generational thing to talking about young people, because we do so much prevention with young people, is what I'm curious about is what is kind of the trauma and the mental health issues we have, because we're talking about risk factors, right? And a friend of mine last year or so, somebody I worked with since the beginning of my time in Wyoming, a local person, she says, Rodney, it's always been about trauma, right? And I said, no, like it hasn't. It was about experimentation, partying, graduation keggers, culture, things like this notion of filtering prevention through trauma is fairly new, I think. And that's not to say that there weren't always people that had trauma, but the idea for us as prevention researchers, as prevention practitioners, people who are doing the work out in the communities, because let's be serious, like I've been doing this 25 years. I've never prevented anybody from doing anything. The people that do that are out in the communities, in the trenches, right? Trauma now is how we filter all this stuff. So I'm really interested in this younger generation, getting back to your question, and the sort of collective trauma, because the mental health crisis is real. There's no question about that. But what does that look like? And how do we as prevention people build that into the frameworks that we understand?
So you're essentially, to me, what it sounds like when you say, we're looking at this through filtering it through kind of the trauma experience, if you will, is that it's more, maybe it's oversimplifying. It's more of a coping mechanism now, as opposed to maybe 30 years ago, if you alluded to when it was experimentation. Or can you measure it that in that way? Like, has it always been a coping mechanism, like for
I
angst
think
and so forth? But is it different when it's a coping mechanism? There's that comorbidity, like there's depression or anxiety, and then.
Well, I think there's a couple sides to that, right? So trauma is not new. If you've ever read The Body Keeps the Score by Bessel van der Kolk, it's just an incredible book. He's at the University of Wyoming. He knows more about trauma than anybody. And I saw him presenting at the Global Exchange Conference in November, and it was incredible. And he started by he said, I'm talking about real trauma, right? I'm talking about war and rape and all these horrible, I'm not talking about, I had to stay home from school because of the pandemic. He said, I lived through it too, but I didn't die. I had a car, I had a home, I had a job. There's real trauma. And not to bring down the podcast for a second, but we've had a pretty tough week here at the University of Wyoming. Last week, a group of 5 members of the University of Wyoming swim team were in a terrible crash on the highway, and 3 of them were killed. And the driver was not, right? The 2 people in the front seat lived, they were wearing seatbelts, the others weren't. But that driver, on a snowy road, 3 of his best friends died. Like, that person has suffered some real trauma.
Yes.
And that sort of trauma has always existed. But I think what's new is the broader sort of mental health sort of crisis that we're living through. I don't want to minimize what young people are experiencing. What I really want to do is understand what they're experiencing, because I think people who cope with real trauma, and Bessel van der Kolk honestly has got incredible clinical outcomes from giving people with real trauma, that kind of trauma, MDMA. Um, he's a boomer too, so maybe, but uh, but there, I think there's a broader general mental health crisis. My wife is a counselor by trade, and she stays home with the kids also, but she has clients, and I mean, in her world, there can never be enough counselors at this point. Everybody is completely booked all the time.
Yeah.
So what I'm really interested in, what I'd love to do, and I wish I had an answer for you, what I'd love to do, and I'm planning a research project on this, is interview teachers and counselors and law enforcement of what they're experiencing, and then do focus groups with young people, young adults in college and not in college, teenagers, and talk to them about this mental health crisis and where it's coming from and what the anxieties are. Because I think that would really benefit us as a prevention community. Because to me, if anybody asked me, like, in the world of prevention, what's the one thing that you think we need to know? And I would say it's the answer to the question why. Because we can't do prevention until we start understanding why.
Yeah.
Which leads me I have a segue to a study we did, but
Okay.
I'll probably throw it in there in a second.
Well, I was going to add to that, I've presented in front of youth, two, I've worked with youth groups, and I get asked a question sometimes that will be very similar. Do you think teens are different today than when you were a teen? And I always have the same answer, that I think being a teen is always the same experience. Are you going to get to go to prom? Are you going to have acne? Just the things that all teens worry about. Will I ever date? That kind of stuff. What I think is different now, and probably is more informed by, as you've alluded to, media, is that they have tremendous choices and things coming at them that I can't even begin to think that I would have navigated with any real, like manageable success when I was their age, because it's just so much all the time. I mean, sometimes I have a hard time as an adult.
Right.
So I think that really is the biggest difference. I may be naive in that, but I think that's why they're different today. And it may allude to what you're saying as far as the
I think
crisis
you're
or mental
exactly
health
right.
is they have to look at the world in a way that I never really had that opportunity.
No, absolutely. And I think, the answer is yes and no. Like, there's these sort of universal things about being a teenager that Socrates
Yeah.
commented
Wrote
on
about,
as
yeah,
well.
yeah.
And then your whole world is like, will I get asked to prom? And, but I think also you talk to anybody who's at any age left the teenage years, and they think, God, I would never go back to that, right? Like, I
Right.
don't want to experience that. We all want to be young again, but not that young, right? And but I am interested in that sort of anxiety that they have, and I know I have kids that experience this sort of anxiousness. I think too there are things in the world to be anxious about: the political divisions, climate change. I think the wars that are happening in the world today, even though they're not like on in our country, I think they're so much closer to young people. They see the horrors of that stuff, and it's so accessible to them all the time. So that's curious. I think there's also young people, and this is really just anecdotal for me, but young people worry so much more about the future than I ever did. Like, I never worried about whether I have a house or a decent job, I see young people worrying about these sorts of things, that I don't think we all kind of took for granted. And I say we all, like, I'm a pretty privileged person, right? I don't think everybody in the America, especially with health disparities and racism and things like that, did that. But I think a lot of young people today worry about a lot of that. and futures that weren't really my problem, I don't think.
You're listening to Prevention Perk. A podcast is like a breakout session from your daily routine. It's a unique way to perk up your prevention efforts. We'd like to hear from you. Please send your comment, topic, or guest suggestion to midamericapttc@gmail.com. Well, I'm kind of curious. So we've kind of talked about like the lens that I'm seeing this in right now is we're talking about kind of like that landscape for the generations that are coming up or, that are here now and moving forward. But what about for us that work in the prevention field? I mean, you've been doing this for a lot of years and you've kind of had that research lens on it, talked to a lot of people, presented on various subjects. What do you think from the preventionist standpoint, what are some of the risk factors that we face? Like we should be able to be aware of some of this stuff when we're looking at prevention going forward.
Yeah. So I don't know if this is a good answer to your question, but I say, I've always thought workforce is an issue. But I think workforce is more of an issue now than ever. And I work in a lot of states with a lot of communities on the ground. And so many of the people I'm working with right now didn't do prevention before COVID. There's so many new people. In the state of Arkansas, we had this Partnerships for Success project. There were 13 regions. It started in 2019, right before COVID. COVID happened, then we finished. Everything had opened up again. But the 13 regional coordinators, when we finished, only 11 of them were the same people. And so we have this workforce that has a different experience than a lot of us, that are still struggling with what it means to work in this field and what this field is, but also for the most part doesn't have that experience. I mean, nobody should have experience like me and you, Steve, that goes back 20 years, but the biggest challenge I see us facing right now with the workforce is teaching them that history of prevention, that things work, all the way back to the Strategic Prevention Framework, the SPIF. And I often said, when I was working with coalitions, you could go to a coalition in a community, and we know we've been doing coalitions forever. You go in and you say, raise your hand if you know the SPIF model. And typically the local prevention coordinator would raise their hand, and maybe one of the coalition members, but everybody kind of shake their head. Today, if you go into a coalition, you say, raise your hand if you know the SPIF model. A lot of times the prevention coordinator doesn't even raise their hand, right? And so we've got to one of the challenges, I think, is getting back to sort of standing on the shoulders of giants of what it is we have been doing successfully for a long time now. And so much of what I've seen, because we have so many crises going on right now, like the opioid crisis is crazy, methamphetamine is a crisis. So much of what I've seen in communities in the states I work in is just leaning into naloxone, peer recovery, all these things, which, by the way, work great and are incredibly important, but they're well funded through other means. And so we've got to get back to this notion of primary prevention, what it means to get people well before we need naloxone. And I think that's one of the challenges with the workforce right now, is getting them to understand that.
And that seems to be a common concern, if you will. You said you've noticed this in multiple states as you've traveled around and work in different communities. And I was talking to Chris Gabrielson on the podcast, and she was at the Great Lakes PTTC, and she was talking about a same or similar situation in their region. I hear the same thing here in Region 7 of Mid-America, that in some of the states that we serve, verbatim what you said, some of the people that were in the leadership roles pre-COVID are no longer there. Plus they're hiring this attrition that happened with just entry level. So it's kind of like, who's leading this initiative? And that's made me kind of think about, I've always felt this way, but really kind of think about spreading this as a tool, if you will, that it's really about the relationships. It's connecting to the relationships, i.e. you and I that have been doing this a while, mm-hmm. to the newer generation, but then just the connection to the relationships in your community, like really setting down and just like getting reacquainted with your neighbor, so to speak. And that might be the neighbor right next to you at the coalition meeting, but that's really a very powerful tool for prevention, because when you get right down to it, prevention really is only effective if people are involved, and you have to have the ability to relate to people in order to really be, successful in some manner. And so I think that we're alluding to kind of the same thing. How do you bridge this gap that's happening? I think in some ways it's about, how do you tell that story? How do you communicate the need for us to play together in the sandbox?
Yeah, and isn't that one of the great lessons we learned from COVID is that prevention is about relationships and being in person. I
Yeah.
mean, prevention not in person was a disaster. We weren't implementing strategies, weren't, and now we're all trying to catch up with that. And so that relationship piece is critical. The other thing I think is because look, I said this in a presentation recently in Oklahoma, and I'll say it here too. It's not something we say out loud often enough. But as prevention people, we are in a battle with the alcohol industry, big tobacco, big pharma, big marijuana, and drug cartels. And their science is better, and they are way better funded than we are, right? But despite that, and this ongoing prevention battle we're in, despite all that, we also have to look back and say, look at what we've done. I mean, we have underage drinking in every state I work in and across the country is been cut in half in 20 years. I mean, it's incredible what we've done that way. When you look at tobacco use, and I get that vaping is up, but it's turning down because it's not seen as cool like it was. But I work in Arkansas, which is a southern state, and I say to people, what do you think that youth cigarette use in Arkansas looks like, is given that it's a southern state and stuff? And they'll say it was 30%, 50%. No, it's 1.7%. I mean, we did that, right? We did that with alcohol. We've done that with tobacco and smoking. Do we have challenges? Massive challenges. But we also have to look back and say, look, what we've done has been really incredibly powerful and significant. And we can do it again, and
Yeah.
we can stem the tide of some of these things. But we do have a lot of challenges in front of us.
I still think that the other part of that is the relationship aspect. And the other part I think is invaluable is telling that story, being able to somehow or another convey to the audiences, because they're so varied, that there is a story to prevention, and there is a story of success about prevention. And I think going back to the research you did with Dr. Linkenbach is really about that perspective of what's really going on, what's really happened, and where are we right now? That is a story that I think is really hard to share, because we do have such incredibly diverse audiences we're trying to communicate with.
We do. And it's been a challenge in all of the field for generations, is to convince people that prevention works, that treatment works, that recovery works. Like, people will ask me, if I talk to a legislature, what should I tell them? I said, tell them that prevention works and treatment works. Like, because until they believe that, nobody's going to invest in it. No one's going to make it a priority. So we have to be able to tell those stories. And in my work, because I do so much around opioids and methamphetamine right now, beyond underage drinking, which has always been my specialty, in my work, I know so many people now that are in recovery from everything from alcohol to methamphetamine to opioids, that are leading these incredibly good, productive, happy lives with families and kids. And until you meet those people, you're like, oh, like, I didn't know, because I think what we get, especially in the media and other places, is a different picture.
Yeah.
So we know that treatment can work. We know that we've got specific medical assisted treatments. We've got all these things that can work, but we also can tell stories about how well prevention has worked over time. The problem with it, though, for us as prevention people, is it takes a while, and people who are on a 2-year election cycle don't want it to go that long. Like, they want a dashboard. It's not a dashboard.
Yeah. This is a history that we have to gather. Yeah. And measuring change in the community. When I would work with people on, developing out their logic model, they'd say, oh, we're going to reduce it by, 50% over the next year. And it's like,
Yeah.
you're going to tick the needle a little bit, but
Right.
to really change the community's perception of the problem, or even adopt the fact that there's a problem to begin
Hmm.
with, and then
Hmm.
begin to change it in a healthier way, is no simple undertaking.
And that's where I think, I can't speak for every state. I worked in a number of states. I've seen a different variety of states from New England to the West Coast and South, Wyoming. Getting back to just those basic ideas of understanding readiness, understanding comprehensive prevention, understanding the CSAP strategies, understanding the roles of coalitions. Like we've got to get these people back to that place. I've seen some people implementing just the worst strategies because, I won't tell you what state or community, but a prevention coordinator who was just like um, the worst prevention strategy I've ever heard of. It was they were essentially collecting beer cans and cutting them up with the kids to turn them into an arch over Main Street to create a conversation. And sort of when confronted with how terrible that strategy is, their answer was, well, we don't have anything that works anyway. What's it? I'm trying. And it's like, whoa, yeah, no, we have stuff that works.
Right.
We've
Right.
got lots of stuff that works. Like, but clearly we're failing as the leaders to make sure they understand what works, and get that to them, and to measure everything from comprehensiveness to readiness to that stuff.
Yeah. Yeah.
So we got to get people, I think, back there. I think there's some other things. I really want to talk about this one study, which somehow I'll segue to it, um, based on the notion of risk factor, right? Because I think it's hard to ignore the fact that while the problems at a population level are small, opioid overdoses, methamphetamine, the problems are so significant. And if you've read any of the books by Sam Quinones, like Dreamland or The Least of Us, you really get a sense of how everything has changed. For all of human history, drugs have been created through the use of plants, right? Whether it's the ephedra plant, cannabis, hops to make beer, whatever it is. It is only recently that you can synthesize drugs as an organic chemist out of hair dye and all these other chemicals, right? Without needing the ephedra plant and what it's done is made them super cheap, easy to smuggle, easy to make. You're no longer, as the producers of like heroin, you're no longer subject to drought or rains or winter. Like you just make it all the time. And so we are in a crisis. And also those drugs are so much stronger. I know in Sam's book, there's a woman that is in recovery from meth, and she said it took, something like 14 years for me to be homeless. Now it takes someone 2 months using meth. It addles the brain. So we have this crisis. So we're working on it. And going back, I truly believe, and I've told this to a lot of leaders, that underage drinking is opioid prevention. It is methamphetamine prevention. Underage drinking prevention is where we start. Same with vaping, right? It's their introduction to these things. But when you're looking at this stuff, we're doing this project in Arkansas. It's a really nice project. It's coming to an end because the funding is over, but it was called the Methamphetamine Prevention Project. And my colleague, Matt Wagner, who's on my team, we really wanted to understand that question, why? Why do you start using meth, right? Why do you do it? And so we interviewed 19 people who were in recovery from methamphetamine. And we asked them a series of questions of basically, why did you start? And then we took all of that qualitative data and we filtered it through basically the models we understand, from risk and protective factors to causal areas to ACEs to whatever. And what we found is there are 4 broad reasons that people start using methamphetamine. And I don't think this is just in our work in Arkansas. This is, I think, fairly universal. And in no particular order, those reasons are access. It's just really easy to get and cheap. A lot of people said it wasn't even their drug of choice. It was just easy to get. When the escape is the point, it doesn't matter, right? But methamphetamine is basically a tenth the price it used to be. And they make so much of it. So if you could imagine going for a cappuccino in the morning for $4.50, how many would you be drinking if they were 45 cents, right? So access is incredibly important. And that's an environmental thing, right? The number two thing is family. Families in crisis, learning from families, and other places. I know, and it's true for opioids, a young woman I saw present recently who's in recovery said she had some trauma in her family and stuff, but she was 11 years old when she had a headache, went into her mom's room and said, "Mom, I have a headache," and her mom handed her an OxyContin, right? And so that was her addiction to opioids started, right? Families, they get it from their family. They're part of this stuff. Their family is in crisis. The third is suffering. People are suffering from trauma, mental health, all these other things, and they're looking for an escape from the suffering. And the fourth is kind of traditional prevention stuff, just the low perceived risk of harm, and things like that, refusal skills, social norms. I know a woman who runs a recovery center, and she said she was 16 the first time she used meth. And she was on a date with a guy. He laid out two lines, and she didn't want to seem uncool, right? So those four things really get to it: suffering, family, traditional prevention, and access. And if you can curb those things, you can stop.
Now you're talking about this
Prevention.
in relationship to methamphetamine, but
Right.
as you're going through it, I mean that's probably a very similar why or entry point for tobacco use, or
For a lot of things,
yeah,
especially in a more specialized area where there's a health disparity, I would say if you're going to do something more like alcohol, you would have to add to that mix culture,
yeah.
which might segue to one of your other questions for me. But you got to add to that. Don't understate the role that culture plays in substance use,
Substances,
how
yeah.
powerful culture is,
Yeah.
especially where you start with alcohol.
Well, let's talk about that other, because you mentioned this to me the other day when we were kind of talking about what direction we were gonna take with the
Mhm.
podcast, and you shared with me that you kind of have like a wish list, if you will, or a
Yes.
bucket list. You would like to at some point see a documentary um, come onto the scene that you would work through about the
Yeah.
history of alcohol, and really about kind of looking at that through a correct lens, that
Yeah.
there really are inherent risks and harms associated with alcohol, because alcohol too often is looked at as kind of a social, it's like, grape juice or Budweiser, it's just
Yeah.
it's a social thing. And we
It
kind of
is.
lose track of that. And you're kind of passionate about the idea of maybe elevating that conversation. So let's talk a little bit about, the history of alcohol.
Yeah, so I was saying it is one of my dreams in the next decade is to make a documentary. It was a colleague of yours in Missouri who had said to me that alcohol is the only drug in America where you have to apologize for not using it, which struck me. And so I have this documentary. I've laid out a lot of it. I have a lot of people I want to interview. The funding is the issue, to be fair. I have a media guy on my team. I have good equipment, but my documentary is called "I'm Sorry I Don't Drink." And it's about the normalization of alcohol in this country, and how much we've made it seem, and it's through so many different lenses. It's whether it's pop culture, movies, college. I know a lot of people that work in colleges doing prevention, and it's such a struggle because they spend the entire year convincing young people that it's not normal to get drunk all the time, that it's bad for your grades, all this stuff. And then every September, they have to start again with an entire new class of people that think this is what you do when you get to college. But we've so normalized it, and alcohol is a very dangerous substance. It is linked to 7 different types of cancer. And I'm not here to shame somebody for having a drink of wine last night, right? Um, but it's linked to 7 kinds of cancer, including and especially breast cancer in women. Um, and it is without question, and we've done 2 studies now of the cost of substance use in Wyoming, and it is without question the most costly substance in America, and it's fully legal and normalized, right? It's costly in terms of car crashes, crime, addiction, and treatment. Like it's so costly, but we've normalized it so much to the point when there was an article that came out in Lancet, which is a medical journal, and it was a study in England that showed that there really isn't a safe use of alcohol, right? That, and I don't know if you know this, in Britain, the public health department, whatever they are for the government, has said the only safe use of alcohol is half a glass of wine a week for an adult male, which is almost nothing, right? Where here we're like, oh, 2 glasses a day. Um, but this article came out and I was listening to, I want to say it was public radio. Somebody was reporting on it. And the woman says, but you do have to take, everything's risky. Driving to work is risky. Flying an airplane is risky. And so, alcohol is risky too. I'm like, you've so normalized the culture of this substance that like alcohol is not a necessary thing to get to your job, right? It's not a necessary thing, but they make it so normalized and so necessary. And again, I'm not here shaming someone who had a glass of wine, but it is a dangerous substance. It's whatever. And we've normalized it. So when you look at sort of historically, and this is a much bigger picture, um, but America has always been a very drunk place. But the other thing is that America has always done prevention. And we think of prevention as something like you and I, Steve, we've been doing, it's fairly new. No, it started with temperance way back more than 200 years ago. And it's went through that. And I don't know, people don't realize this, but the Women's Christian Temperance Union actually created a in-school curriculum for alcohol prevention called Fight the Drink. By 1900, it was being used in every state in America as a prevention curriculum.
I did not know that. That's fascinating.
Yeah, it was supposed to be science-based, but to be fair, and also there were a part that said, if you drink too much, you'll burst into blue flames and die. So not quite science, but and then they were critical as part of the group, along with legislative people, to create prohibition, right? And prohibition is seen as this massive failure in America. It was a moral policy without question, and it really was similar to the difference between the sort of rural and urban split we have today. It was a very rural, middle America kind of policy, and it had a side to it that was discriminatory, that was sort of anti-immigrant, that was definitely anti-urban. But historically, there weren't program evaluators like me studying prohibition, but historians have come through and said it was a massive success. Alcohol consumption in America was cut in half. It's never been as high since prohibition. People were saving more money. Fathers were staying home. Like, there were all these things, but it was a moral failure. And it was also a failure legislatively in terms of just what you were trying to accomplish. There were 250 or something prohibition agents in New York, in the state of New York, to cover all of New York City, the Canadian border, the waterways, and there were something like 32,000 speakeasies in New York City. There's no way it was going to succeed. And then so it ends, and most Americans are super happy about it. A lot of Americans were just happy about prohibition because it made it fun. It ends, and one historian said prohibition was the single best thing that ever happened to the alcohol industry. And then you kind of look and say, well, what do you do next? We've been through all of this. We're this other culture, and that's when the alcohol industry made alcohol sophisticated. It made it like what you do with your free time. It's what you drink when you're camping, or and you get these two martini lunches, and then you get, by the end, you do have moments. Like in the Days of Wine and Roses, if you've ever seen this ancient movie with Jack
Oh,
Lemmon.
yeah, I have.
Right? I mean, incredible movie about addiction. And one movie critic said the reason it didn't win the Academy Award is it was just too darn sad. And so you do have that side of it, but in a lot of ways, you've got just like the hard drinking, hard-boiled detective, the partying college student. You get these sort of tropes, American tropes that are cultural. And then you get in and then you get to an era where we're doing prevention and stuff like that. And what you learn from it all, if I have a message for that, like sort of history of alcohol in a nutshell, what you learn is it's going to change. Like, times change, right? And culture changes. And what's incredible about international research on alcohol is that per capita alcohol consumption is a pretty good predictor of cirrhosis rates, but almost nothing else. A lot of the consequences to alcohol, other than the very specific health ones, like a link to cancer, a link to cirrhosis, a lot of the consequences, like drinking and driving, violence, rape, are culturally defined. And different cultures have different sort of consequences. And so there was a study in England, a psychology department that built a pub in the department, right? They brought all these people in, got them drunk to a certain level, and documented and studied their behavior. And then they brought a whole nother group of people in and gave them the same drinks, but made the people think the drinks had alcohol, but they had no alcohol in them at all. And guess what? Their behaviors were the same because they thought they were drunk, right? So a lot of the way we behave when we have too much alcohol, a lot of the consequences to alcohol, social consequences, are culturally defined, which means for us as prevention people, if we can change the culture, we can make a difference. And if you go all the way back to the beginning, there's never been as much drinking as there was in early America. But we didn't have these sorts of consequences in early America because there were social standards. And social standards make a big deal.
That's fascinating. Well,
That's
I hope that comes to fruition for you, because it fit nice in that discussion we had earlier about, bridging the gap between what has happened, standing on the shoulders of giants, and kind of helping people to understand that prevention is effective and there is a place for it. It's just getting the right people to support it. And your documentary is one of those things that if there's anyone listening that wants to support Rodney's documentary.
Yeah, right. Buy my book. I'll get 30 cents for every copy.
You're on your way. You're on your way.
In
One
any
book
case,
at a time.
yeah. No, I do. I am looking for. I'm slowly building toward that. I'm really interested in this notion. I like thinking about culture, and those sorts of things. So I do. I'm gonna let you ask your next question, Steve.
Well, I just we talked about a lot of things. I think you're fascinating. The research that you've done and the experience, and two old guys getting to talk about doing this for decades is you get lots of anecdotal stories, and it's fun. So
how did it get to be this long? Like I to be honest with you, I'll say some names that most people. I'm going to throw names out as if they're famous, but they're not. Not Brad Pitt or whoever, but there were these people that I looked up to, Bob Llewellyn, Wayne Harding, Roy Gabriel, just brilliant prevention researchers, stuff. And they're kind of all retired now. And I just said, how did that happen? Like the people that I thought of as mentors in prevention. And so it does fall to, I think, people like you and I, Stephen, Jeff Linkenbach and others, to say, we've been doing this for a while and let us pass on some wisdom. Yeah. I'm not sure young people want the wisdom based on how my children look at me, but I do think that there is a role.
That's the dad jokes that they're
the eye roll. I actually have a dad joke calendar on my desk, but no, I mean, I think they're not necessarily want to, but I think that people, and I'm not going to go with elderly yet, but older people have been in the field for a while, that lived through the SIG and the SPIF SIG and the beginning of the PFS, and those of us that, and maybe I hope that somebody who listens to this when you release it was at the April meeting in 2004 when Mike Lowther said, I have this idea, and I call it the SPIF, right? Like, it changed our world. It really did. And we're still living with that sort of fundamental understanding of prevention. And I think that people like us there's a role, but also a responsibility to pass down that wisdom and raise the boats of especially young people, because I think we get a lot of young people working in prevention.
You're listening to Prevention Perk. In planning community and social services, perceptions of need come from many sources. But the first step in conducting efficient and effective community interventions is to look beyond perceptions and identify the actual needs based on available evidence. A comprehensive needs assessment is essential for securing funding and designing programs. The Community Needs Assessment Workbook can help you collect, analyze, prioritize, and present local data in a way that will ensure that a community's needs are understood and met. There is a link in our show notes to learn more about this workbook. Well, we've talked about a lot of things. I always like to leave the last question for the sage on the stage, so to speak. So that happens to be you today, Rodney. So is there something we didn't talk about that you're like, definitely the audience needs to know about this?
I'm really fascinated. We've talked about the meth stuff. I think the cultural stuff. I think the mental health stuff. I really want to do the passions I have right now. I have three. And I'll tell you, one of them is this notion of mental health. I really do want to interview young people and get an idea, because I think we all need to understand what this mental health crisis looks like from a prevention perspective, not from a psychologist or a trauma expert, from a community prevention perspective. What does this look like? How is this impacting how we do prevention? How is it changing what we do? I think the notion of alcohol and culture, that documentary, is obviously a passion of mine. And I have a third that I'll leave you with. And that is the canyon that, until I started working with treatment and recovery projects and stuff, the vast canyon that exists between the prevention work and the treatment work. And for those of you that listen, and Steve, I know you've seen this Institute of Medicine continuum of care, where it looks like, one of those old elevator things above an elevator where it goes up the floor and the dial moves, and it moves from sort of like health promotion to universal strategies to indirect to selected, and then you cross a line, you get to treatment strategies, right? And I would argue, and I'll give you a couple of examples of this, that line is a mile wide, that those two things are very far apart, and I'll give you a couple of examples of that. In the world of treatment and recovery, we know that a substance use disorder, whether it's alcohol, opioids, a substance use disorder is a disease. It is a disease just like diabetes, like cancer, and it needs to be treated like a disease. In prevention, we teach people to make good choices. Nobody chooses to have cancer, right? And so we are so far apart right there. That prevention is so much about the right choices being with right. Also, we know in the treatment world, the worst thing you can do to someone with the substance use disorder is arrest them and throw them in jail. That does not help them in any way, right? But in prevention, visible law enforcement is a best practice. And so I'll leave you with this, that I think that our fields need to find a way to bridge that canyon. We need to find a way. For example, maybe law enforcement does play a good role, and maybe we do need to arrest people, and it's not that we arrest them that's bad, it's what we do after they're arrested that doesn't work. And so I think the fields, we need to come together, and I have a list of some 12 or more examples of where our fields are really far apart, where we need to start finding that common ground. And I think that's critical for the future of what we do with substance abuse. That was my last answer, Steve. How was that?
It was wonderful. My guest on this episode has been Dr. Rodney Wambeam. You'll be able to find links to connect with him in our show notes. Thank you, Rodney, for being here.
You are welcome. And if you leave people in the show notes, my email stuff, super happy to talk to anybody who wants to.
And thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under Your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.